Welcome back. You're still watching Daybreak, and a bit of feedback. Bobo Wino is saying that Harambee politics was marred by corruption until it was banned, and in July 2024, President Ruto acknowledged going on with it is unconstitutional and showing bad example to Kenyans. And the others were saying that Engineer Azaro is saying that politicized giving to God is an abomination. Let God judge, not man. Mheshimiwa Susion, in 30 seconds, you wanted to close on that particular topic?
I think we are getting out of context when we talk about donations being given by individuals in churches. Everybody donates. The members who attend, the congregants, the guests, and the who, Honorable Manzo, and all these waheshimiwas. If we speak the truth, because they are leaders and they're invited by the churches, they give their donations. I think let us separate other forms of harambees in other social spheres of life. Yep. That is what is governed by the law. And we are happy as a country. CDF came in to eliminate harambees for schools and other basic things, which has been done. But the churches was not guided, because once you walk into the premise of a church, it is your own personal conviction to decide what to give. And when you give, others cannot begin guessworking that this is stolen money, this is what. It's neither here nor there. And I'm sure Hon Manzo is talking seriously about... Is it possible
for people to steal and give to the church?
No, you can't steal and give to the church. Of course, that would be wrong. But then it is difficult for
us. So how do you make sure that doesn't happen, that public resources are not stolen to be given or to whitewash them in church?
Some. We do not have powers, and even you, capacity, to know the source of what somebody is giving in church. And when you walk into churches...
My question is, how do we control that you don't end up having people stealing public resources to give to the church?
How are you going to do that?
You have just told me that it's possible.
Infrastructure?
You said it's possible, right?
It is possible that churches can be used for that.
So how do you make sure that doesn't happen?
It is not possible to stop. It is not possible to stop. Let us not do a game in futility. In fact, we're engaging in what we call fishing expedition. The church is an open place, is an altar. People walk in. You give what you have. And others give generously. Of course, when you talk of the president, he's not beginning to give today. He's known to be a generous giver in terms of churches. He's known to be passionate in ensuring that programs of churches are completed. Even the Catholic donation that was given the other day in the Catholic Church somewhere in Nairobi, that money was never returned. And that was the request of the church.
What do you mean the money was never returned?
That project... Pardon?
What do you mean the money was never returned?
Of course, the money was never returned.
How do you know that?
It was used by the church. We know.
They announced.
We know. You go check. You go check. We know. And what the president gave last Sunday, because I know this is what is triggering the discussion. Yeah. It is the president as a person who attended that church. It is the president who interacted with the church leadership, the congregants, and I am sure several requests were placed before him. And as a leader, he provided a solution. One, by donating his personal 20 million. Personal. It's not public. Personal. And committed to mobilize friends to raise 100 million. You know, wherever you go, even David Ocheng, if you go to a project, you say, okay, this project is 10 million. I'm giving 3 million, but I'll talk to my friends and we'll be able to raise 7 million so that you're through with this program. It is problem solving as a leader. That doesn't stop. The rule on fundraising doesn't stop leaders from
how many churches do you have in the country? How many churches have needs?
Many. All the churches have needs.
But I thought...
all the churches have needs. They have budgets.
But who said as politicians we don't build the church? Who said that it's us who must build the church as politicians? Who said that?
And the donations being given, the donations made every day, either in terms of sadakas, in terms of tithes, and in terms of general donations, is what is used to run the church. That is the culture.
Some know you want to close this, but I know you want to close this, but let us not use spirituality to try to cover one thing that has been Kenyan's problem for a long time. The issue is not whether harambees are good or not. The issue is not whether someone should give to church or not. The issue is not about who is generous and who is not generous. The issue is that we don't want public servants stealing government money and giving in churches. That is the issue.
Yes.
And it has to be handled. So that if I say I'm going to bring my friends, and these friends I'm bringing is Elachi is my friend, I'm bringing Sosoni is my friend, Manzo there is my friend, and what Manzo brings to that church and is announced as half a million shillings, we can trace it back to what Manzo has done in government. That is the issue. That's why we don't question what private individuals give. If an government individual comes and gives 20 million, we don't have an issue with it. But you have an issue with public servants giving resources to churches where their sources is questionable. And that's why the proposal I made to you, I believe, we must get a way of ensuring. Because historically, you saw, during Moi's days, and all kind of things, this issue for Harambes to churches and general to schools was being abused. You know, because then there was pressure on you. Sam, I should be able to give 50,000 shillings to a church because that's what I can afford. I should be able to give 10 shillings to a church, and I can give it quietly without having to announce. And I've done that, personally, I've done that in churches so many times in my constituency. You don't have to announce it. So I believe we must get a balance here. And I don't think on this matter the president must have the last word. No. Okay. As a country, we must get a way of dealing with Harambes by public servants. It's not something we're going to sweep under the carpet and use spirituality to be the one saying, heart.
I want to close on this, unless you have a burning contribution.
No, I just want to say this. Then why can't we just do this so that we come out of all this, I don't know what I'm saying, but I don't know what to call it. If you want to really help a church, just go get the BQs of that church. I think that's the last I saw the former president doing. To Ridgeway's Catholic Church. And it took some good money, yes, but he brought everything. So maybe what the president just needs to do, if you want to help the church, ask them their BQ and send them the cement they need. Just tell them, we have paid for whatever you want to start building with. It will be delivered, the stones. Also, it helps to be accountable to also the monies you have given. You will see everything coming. Because why Christians want you to announce is because they are also clustered as families to contribute, isn't it? And you see that in our Catholic Church. So we contribute. We contribute in Jumuias, we contribute in that. And so, in the end, don't think they don't question.
So when you contribute in Jumuias, you belong to that church? It's not a friend's church?
No, I'm just saying I will bring other friends, yes.
Yeah.
But I'm just saying why Kenyans will want you now to announce is because since we have been contributing, and I'll say this because I went to an SCK church in Kirinyaga.
Yeah.
Went with a friend, we were 5 of us. We took our tiles and everything. We took a whole truck of the things we wanted because of her mom used to go to that church and she was late and she had promised. So we went to finish. We went and counted everything that was needed. But then in the end, we had shows asking, they were asking in Kikuyu.
You want to translate that for the
viewer? They were asking, and that's the money we removed now. What is it going to do since they brought everything? So that is why I've told you the problem we face, which all Christians, we must pray to God to help us, is to be trustfully to the things, both from the church side and from the politician side. Let us be trustfully to God. That even when you're giving, it is going to do the work you have said it's supposed to do.
Now, Senator Manzo, 30 seconds, if you have anything to add to that topic.
Well, I just want to say it is between an individual and his God.
Okay.
And what you do with your God is what God and you know. And that's why God says you pray quietly. What your right hand does, your left should not know. And the people must always remember the story of Savaila, who made the wrong declaration in a church and immediately was sentenced to death by God. So you must be truthful to God.
Preach, Senator. Now, let's transition to the topic. The Auditor General has released a report onto the question about the procurement of the system that is supposed to manage the universal health coverage. It is called the Healthcare Information Technology Digitization System that cost 104 billion shillings. The control of budget, the Auditor General is saying that the method used was specially permitted procurement procedure, and it was not included in the procurement plan nor the medium-term budgetary expenditure framework. And this is against Section 53 of the Public Procurement and Assets Disposal Act, which provides that multi-year procurement plans may be prepared in a format set out in regulations and shall be consistent with the medium-term budgetary expenditure. The auditor concludes that the management is in breach of the law. Also says that this plan, direct sourcing of a partner, is inconsistent with what the law provides, which Article 227 requires fair, equitable, transparent, competitive, and cost-effective ways of acquiring goods and services. The scope of the contract is undefined. The installation of system in public hospitals, the number is not known, is not defined in the contract. And the contract provides for some 7 billion shillings to go to training, support, and customer education costs. The number of healthcare facilities and the healthcare workers involved is not indicated in the contract, so you're spending money without a justification of the numbers. There's lack of payment arrangement agreement. It says that the consortium proposed a funding model and the charging of fees from shift contributions, meaning that every member of SHA who contributes, 2.5% of their contributions will be going to paying for this project. The healthcare facilities, that is the health facilities or the hospitals, every time they make a claim, 5% of that claim would be going to financing this project. And also there is a 1.5% that will be charged from the track and trace solution. The period of this contract is 10 years, and the projected revenues that would accrue to this project is 111 billion shillings. And the Auditor General says that the funds were to be transferred to an escrow account daily or in not less than a week. And of course, says that the verdict, according to the Auditor General, is that there is a material fact of levying fees from the public without evidence of public participation, which needs to have been conducted as per the Constitution for the sake of openness and accountability. Senator Manzo, I'll begin with you on this one. And listening to what the Auditor General is saying, what does this tell us about the conversation we've held the past many months since it came to the fore that this project was being invested in by the government?
First of all, last Wednesday, the Minister for Health appeared before the Senate, and this was the main issue. And supplementary questions after supplementary questions, the Minister herself, who is a medical doctor, and who should be knowing about this practice, was totally unable to satisfy the senators as to what SHA and SHE was all about. When the laws of SHA were being made and their regulations, it was extremely controversial in both houses. But because of the big numbers, those laws went through and became law. In fact, I remember Omutata and quite a number of us went to court on the issue of public participation. There was a constitutional bench of 3. Clearly, you know, there was no public participation, but the courts, under a lot of pressure, ruled that there was public participation, and they were not the ones going to stop Kenyans from enjoying good health. Unfortunately, this matter has caused a lot of ripples in the country. Practically in the hospitals, you know what has happened. Some people, a lot of bills have not been paid by this organization, and a lot of times you still have to contribute before patients leave the hospital or before their bodies are released in case they die. You saw a lady who was about to go for surgery. She only gave 2,000 shillings while she expected at least 400,000. And you know that has gone unaddressed, and now we begin to understand the illegalities involved. This is our, you know, even for 104 billion shillings, I believe that would have been enough to fix whatever problem was with NHIF. But unfortunately to me, this is a big scam. It needs serious investigations. All those unanswered questions by the Auditor General should be explained, and most probably, maybe this regime or another regime, people should be prosecuted. I mean, money is being collected from poor people to be taken into places, you know, to pay something you don't even know what it is. We have, you know, quite a number of employees of SHA have said are totally unable, you know, even to access the system. And a lot of times, you know, it has raised a lot of complications. So this is...
Sorry, you said SHA employees?
You know, the employees, the people who are supposed now to feed in people. You know, this is a system which should contain all the information. The one will be sold for so much money. And of course, this is a system I'm sure will be updated quite regularly.
Do you know if it's in existence, this system, by the consortium?
Personally, really, I don't know. I can only rely on the information of the Auditor General. That no one knows what it is. And it has several legal flaws. There are many unexplained things. No public participation. And therefore, the health crisis, the health system in Kenya is even in a bigger crisis. And what it does now, it goes back to the same MPs who passed it. You know, your constituents now come for you, pay for these bills. That's what is happening. We are paying from our pockets. Personally, I'm paying for it, 32,000 shillings every month. In fact, I'm also on a different insurance. In fact, if this was working properly, it's a transparent thing. All of us should be in this insurance. There should be no other medical insurance in the country.
Right.
But it doesn't benefit me. It doesn't benefit my constituents, yet I'm paying for them. Poor people are being encouraged to pay 300, 400, you know, shillings a month to belong to the system. When they go for treatment, it's never done. They have to go back to the MP to fundraise. So it's a big crisis, and I think it should be sorted out.
To fundraise, just what we were talking about a few minutes ago. But Mheshimiwa Elachi, where does this leave us? If the Auditor General comes up with this report, and ordinarily Parliament is the primary consumer of such reports, so then what?
Well, you see, Sam, one thing I've come to realize in our country, we are very interesting people, And I'll just say what I said in Parliament. You see, it is important. I think the people who have the idea, this universal health care, yes, really, every president has really tried to push this thing. Fine. So we are here now. But then the question now that I will ask, which I think the person who will be good to answer is the MOH accounting officer, who is the PS. Number one, when you hear the Auditor General, then you come and ask yourself, is the system a service model where we are leasing the way we did the first project when I was in Senate of leasing equipments? Is it that model? After he answers that question, then you tell them. So it is, in a layman's way, I will say it's like the expressway. Because when she says the monies must go somewhere, it means government did not remove any money. There are people who have serviced this thing, and you need to pay them as Kenyans for you to use this ecosystem that I see was so large that either carries the facilities, carries the devices, carries connectivity, carries every storage, cloud, all those things. And then the person who has been given this responsibility, who they trusted, I'm trying to think through, Sam. So it's just...
Carry on.
It's Safaricom, because it's the largest connectivity internet company that we have, that has internet, that has infrastructure. But the question now will come back after that is that after they took Safaricom, we have leased the service, the best they would have done, and this now, and I'm sorry, it brings in very many other agencies of government, because the AG also is there to say he advised before you even arrive at Treasury to say now you are being given a leeway to use what in the Procurement Act, which is legal, because they used one of those options we have given on how to procure. So, and then you ask yourself, so who runs the registration platform? Who is this person who is running the operations where Ministry of Health has roughly 19 institutions, are they on this platform? And I'll give you an example. Did they want to try to do what now Governor of Murang'a is doing?
What 19 institutions?
Well, we have KEMSA, we have NKNH, we have all those. Are they part that they will benefit on this magnitude system that I asked in there? I'm asking the same questions I asked Pokose one time when we were doing this in the House. Yeah. That you see, you need to clear people's minds to understand. And so even when the Auditor General is coming, so who is the internal auditor of MOH? Because before she brings out this, definitely I know her team walked in and they asked. And for her, it means...
But wait, Mheshimiwa, and sorry to cut your trail of thought. The Auditor General and also the internal auditor, they come in after the fact, if I'm not mistaken.
No. The internal auditor, why I have employed you as an internal auditor, is to help me to guide whether my systems are functioning before the external auditor comes and audits me.
What I'm asking is, does the internal auditor audit the procurement process, or they wait for you to conclude, then look at it?
You see, them, they have an opportunity. That's why we call their internal, they are ours. When we are continuing with the process, our legal teams that are within our institution are supposed to be guiding us, isn't it? They are guided, then they go to the AG, they ask, the AG also gives his own external advice of what he feels, whether it is right or wrong, where you are headed, and you keep those reports. Then now the internal auditor, after you have done, but before it even comes out, he comes in and he audits. And he tells you. That is why you'll find sometimes...
the problem with the internal auditor or the procurement...
No, I'm not saying that, no, it starts from the procurement. Right. So I cannot say the problem is internal. I'm just saying, for her to pick now that, she's picking it from the reports that themselves, MOH, have already produced. So it means, did you advise your clients well? Or what was the problem? Or they did not want to hear? So if those are all the questions we are going to ask, then we shall say, from the process beginning of the whole thing, there's somewhere each one of you, do I say we're sabotaging each other? Yeah, but one thing we need now to understand as Kenyans, the model. You know, the moment we understand the model, we'll stop talking to government and we'll start looking for who are now the owners.
Okay. All right. And we'll get to the owners shortly. But Mheshimiwa Cheng, I'll come to you, Honorable Sossion. Mheshimiwa Cheng, again, the question I asked Mheshimiwa Elachi here. So the auditor's report is in. So what?
So a couple of things.
It's not the first one, really.
A couple of things, Sam. One is, if you walk down the street today in the morning, or went to Kibra, or went to Kilimani, it doesn't matter where you go to, up market, down, market. What Kenyans want is a working healthcare system. They want that when they go to the hospital tomorrow, they are able to get treatment and they go home without these hassles they are talking about. I need to put a rider, Sam, on this issue. That the new healthcare system, for me, is the best you can have in any part of the world. The laws we passed, the primary healthcare, the digital health program, the chronic, emergency, chronic and critical illnesses. All this, for me, because I sat and think through this period, I presided over this, and I had a chance to read the law. So in terms of what we set up as parliament, the system we intended to set up is beautiful. We are getting failed, in my opinion, at the execution level. And before I go to the audit issues, and I think all of us were adults here, in 2008-9, the then President Obama tried moving something called Affordable Care Act. It became Obamacare. And it had the same oppositions. It had the same kind of issues, By the way, the vote on the Obamacare was in the Senate 50-50. 50 Republicans, 50 Democrats, with Joe Biden, then as Vice President and presiding over the Senate, casting the tiebreaker, as it were. Now, remember when Trump was campaigning, he said, the first thing I'll do when I get elected is repeal the Obamacare. Did he? Why? Because by the time he was talking about repealing it, we had 37 million Americans benefiting. So I believe personally, Sam, that what we have set up in law about our healthcare system must work. We got no choice about it.
Yeah.
As we speak today, Trump is no longer talking about repealing Obamacare. He's talking about, I'll make it better, and then I can repeal it. I mean, of course, he's admitting that it's working. And so I believe that what Kenyans want is a working system. And I believe along the way, the ministry dropped the ball. Because, Sam, today, if you go for treatment at level 2 and 3, Dispenser Health Center, it's free. Few Kenyans know that. Because they're not being told. They don't know that for you to be able to get to a level 4 hospital, you must have gone through level 2 and 3. Mm-hmm. Most Kenyans don't know that the premiums you are paying only kick in when you go to level 4 hospital.
Sorry, on that point, that you're saying the primary health care is free.
Yeah.
But how much money have you allocated for that?
I'm going to do that just now because we need to get
just 4 billion out of a requirement of 50 billion.
We need to get this. We need to get this clear, Sam.
Yeah.
And like I said, we have a law that regulates what you need to do. Mm-hmm. We have the executive that's supposed to implement that law, and so we'll not shy away from saying things that are not being done. You cannot keep quiet, not telling Kenyans that, hey, we're providing free healthcare at level 2 and 3. Mm-hmm. 2, we want you to join the social health insurance fund so that you're able to get service at this level, so that they can then demand these services. And so I agree with you, first of all, that we are underfunding the system today.
Yeah.
The primary healthcare is underfunded critically. The emergency, critical, and chronic illnesses are underfunded terribly. Yep. Okay? Because someone is hoping that we'll get some money from the social insurance to be able to, to cushion this. So in terms of how this is supposed to work, Sam, I can tell you, and I want to look at Kenyans in their face and tell them there are problems, but this system we set up must work. Mm-hmm. And that's why I personally agree with the Auditor General's questions. Because these questions must be answered to make this thing work.
It looks like a verdict, really.
You know, we have this matter in court. The Honorable Manzo has told you. Yeah. It's a pending matter in the High Court today. Mm-hmm. And I hope when this report comes to Parliament, we'll do justice to it.
That's what I'm asking.
Yeah.
Because now it's here. And Parliament is the primary consumer of Auditor General's report.
Correct. And Parliament is the one that passed this law that is not being implemented to the letter.
Because previously she has, and the Office of the Auditor General has given different reports that are damning, especially when looking at different projects that the government has gotten into. Then what? With this particular one?
I agree. You know, you lost money, if you remember, from all the way from 63, Canvain, Golden Bag, and all these things come to Parliament. And I believe it behoves us, it's upon us as Parliament, I believe, to make sure that SHA works. And I hope that the Auditor General's report, and I'm waiting to see how, the ministry has responded to this. They are saying that, under Section 114A, they were allowed to with the special facility for procurement. They're saying they have done due diligence and all these things are going to work. I hope that when this report...
Is it a question of the State Department explaining or its action being taken? Because when she says that they breached the law, that's quite categorical.
Yeah, but Sam, the way you read the law would vary depending on where you are, and some of them are lawyers. Mm-hmm. The ministry is saying that we have a section of the law, Section 114A, that allows us to go out and prospect and get the right partner. Mm-hmm. Okay? Mm-hmm. Now, the Auditor General is saying that may be true, but we have Section Article 227 that requires that even as you do that, you must promote fairness, transparency, competition. Okay? And so the ministry must answer those questions, whether in this process they promoted those. The Auditor General is saying this didn't happen. So these questions again will have to come to Parliament, and Parliament will make a verdict based on what will be placed before them. That's the position. But
and how do you do the verdict, whichever it goes?
People have to be prosecuted if there's a malfeasance. If someone went to follow the law, they must be prosecuted. I mean, that is how the system works. And so I get your frustration because we have lost money before.
Not mine.
I mean, I am as frustrated as you are, Sam, in terms of this issue, and that's why I say I get it. Yeah. Because even me, I want to be sure that the public money, as Sam has told you, that we are contributing. I'm giving 32,000 shillings every month. Yeah. I had a surgery on the 15th of November last year. Do you know when the money was paid from SHA? Last week. I got a message on my phone last week. Now, I'm lucky that I had another insurance. Right. What about these Kenyans who don't have that insurance? Okay. And you've had private hospitals saying, we'll not allow this to work. But Sam, there's something that I really wanted to say before we leave that place. We should never forget where we were with NHIF as these things happen. Do you know, because I had Laji talking about the system, do you know this under NHIF, one officer could approve the whole chain. You could go to the hospital, say you're somewhere in Kirinyaga or somewhere in Kisumu, you go, and you call your friend at NHIF, tell them, I'm going in. They need 4 million shillings for this. One person could approve your use of NHIF at the hospital. He could approve you're being flown to India. He could approve one person. Okay. All that process. Then when Susian goes in there, he's told we can't pay this. That's how bad NHIF had become. Okay. Fraud, and corruption. We'll get back to and so
those specifics, especially on the workings of the current system.
And so I believe as Parliament, we have a very, very big role to ensure that SHA works.
Okay. Mheshimiwa Susion, so the auditor also finds that there are unfavorable contract clauses, including the contract prohibits the State Department from developing another system, meaning that the Ministry of Health cannot come up with a system that does the same work, at least for 10 years. And then on dispute resolution, the contract is that arbitration will be under the rules of London Court of International Arbitration. So the procurement happens under Kenyan laws, but the arbitration would happen based on London rules of arbitration. Then the mobile network operator company consortium to deliver system as a service solution where end users connect to the system hosted by the consortium without the need for installation or management of the software in the end users, meaning that every hospital will just be connecting to that service, not necessarily having a software within their own precinct. And then when it comes to project financing and payment model, the financing is projected at 111 billion shillings, which is to come from contributions by SHA members, the claims by hospitals, as well as something else on tracing and tracking. Then clause 12.4 of the contract in the general conditions is projected revenue will be transferred to an escrow account to be held by an escrow agent appointed by both parties, but now details of the signatories have not been provided in the contract signed by the Ministry of Health. Mheshimiwa Susion, what should we do with this information?
Yeah, and the bigger question is, what should we do with the auditor's report? Because the Comptroller and Auditor General has prepared a report with respect to procurement of these particular services, pointing out matters that looks very grievous, but we have not gotten the response from the procuring entity and the user of this service and facility. It would be wrong for us, even in this show, to make an instant and quick conclusion. My belief is, if really we want to roll out UHC, let us be absolutely honest. And a document like this one of Comptroller and Auditor General should be scrutinized. And who is supposed to scrutinize? The National Assembly. It has a responsibility to do that. They will be able to flag out all the issues. They will be able to put the ministry to account to explain and justify why they went the route of specially permitted procurement procedure, why Safaricom is the dominant controller of this program, and whether the taxpayers are putting in any money through the budget, which I understand they are not doing. And Sam, I've worked in the healthcare space, representing teachers at NHIF as a vice chair of NHIF, and at a time when universal healthcare was being rolled out and it collapsed because of many things, and I took teachers out of NHIF to run their own insurance scheme, which of course had a lot of issues and a lot of politics like this one because a lot of interest, but I stood firm. It is now working and teachers are being treated. The same case with UHC. It is going to have politics. It is going to attract challenges, but as clearly stated by Mheshimiwa here, it must work.
It must work.
And if there are dirty issues around it, if there are dirty issues around it, that can be proved.
How serious is this report?
Well, we'll treat any report as serious as it is portrayed until it is approved by another counter report from the Ministry of Health. But I've seen the Ministry of Health. Yeah, of course.
What is the work of the Auditor General?
The work of the Auditor General is to give an audit report and supply to Parliament. And what is the work of Parliament? Oversight. What does Parliament do? You oversight the state departments of government.
What information do you foresee from the Ministry of Health that would overturn what the auditor has found?
Yeah, the report from the Ministry of Health will just be about facts. If indeed the specially permitted procurement procedure was done procedurally and properly advised by the Attorney General, then it will cancel the conclusions of the Auditor General's report. I think what we need to do here is to be very open. Let us not look like we are defensive. Let us not look like we are also too offensive without allowing the ministry to account itself. Because to roll out UHC is not easy. Ghana rolled it out and it collapsed at some point because we didn't get things right. One thing I'm happy about what the National Assembly did was to come up with the Public Health, the Primary Health Care Act. And you know the Primary Health Care Act, as Mheshimiwa stated here, is fully funded by government. That you walk to a dispensary, you are treated. It is not paid by SHIV contribution. The members' contribution, that's what I'm saying. Not paid.
That's what the law provides.
Yes, that is what the law provides. Now, it's only 4 billion that is what law provides. That is what law provides.
Yeah.
And level 1, level 2, level 3. But when you get to level 4, then you have you also have the SHIV coming in, because from level 4 upwards up to level 6, those are areas of referral. So the Primary Health Care Act, which is fully funded by government, and if it is not being fully funded now, then there should be more enhanced funding. And that communication has not gone to the public. People believe that as a contributor, the SHA contributions will be used to finance the primary health care service, which is wrong. And when I checked the data, because I was keen in knowing the data, what has happened from October up to date?
Yeah.
The primary health care facilities and the act itself has expended at least 1.2 billion for 3 months. That is the month of October, November, December. And in the month of January, it is expending over 800 million. And it is being paid at the end of every month. And you see, when you're rolling out a program, you don't deploy everything all at once. You keep testing systems and improving. So according to me, I'm satisfied.
For 2 months,
yes,
you said 1.2 billion.
1.2, and it is yet to receive another. Yes, for the month of, not 2 months, 3 months. The month of October, November, December, 1.2 billion. So the month of January, the month of January.
That's an average of 400 million shillings
and then
per month.
in the month of January, because of increased activities at the primary healthcare facilities, it is now at 800 million. So it looks like it is growing. There are a lot of activities at the primary healthcare. In UHC, the primary health care is a port of entry to the entire process up to level 4, 5, and 6. And when activities are intensified and services rendered, then you will see the activities going up. So according to the data, because data doesn't lie, this is now a total of 2 billion that has been expended at the primary healthcare facilities. Have Kenyans who have visited the primary healthcare facilities been treated? Yes. And which are the primary healthcare facilities? They are both health dispensaries for the public, the private, and faith-based facilities. That has been done. And then on the SHIV, the inpatient admission at level 4, 5, and 6, 16 billion has been spent. Meaning patients who have been admitted and treated have been covered by SHA. I'm talking about SHA. And emergency and critical illness because this is evacuation, this is ICU, these are other.
How much?
Yes, about. I saw something like 400 million shillings, and you know the emergency ECIF is added on top. The first line.
By the way, Mheshimiwa,
first line.
Sorry, how do you know this?
I've asked these questions, and I'm asking questions that I've extracted, and this is data that I've gotten, and I'm free to talk about it, and you can cross-check. So when I look at the three health, the PHC has worked to the tune of 2B. The ECIF has worked to the tune of 400 million. And when I look at the program, the next phase from March, is that even the ICU, because currently SHA SHIF is covering at 4,000 ICU. It is going to be enhanced to 28,000 with effect from March. I've asked about
effective March.
Yes.
When was that gazetted?
Effective March. Yeah?
When was that gazetted?
No, it's not a question. This is information, whether it's gazetted or not.
I'm asking, you know, Mheshimiwa Susan, it is important that because SHIF, SHA, they work for the public. It is important that information is available to them. So I'm asking, now that you know that it's effective March, when did this become public, and when was it gazetted? Because if you're to look at the tariffs and packages that are being implemented today, they were gazetted.
Now that brings me to what we call public communication. I said from the beginning, even the public have not understood that if they are getting to the primary healthcare facilities, they are not paying anything. It is not part of SHIF, but it is PHC, which is paid for by the state. And the delivery of UHC model here in Kenya is a mixed model, where the state is financing through budget.
You have not answered my question.
Yes?
Let me look for answers from Senator Manzo here.
Yes.
Because all of them are in agreement that Parliament has to consume this. I don't know if the Senate will or it's just the National Assembly. But what would you want
how this devolved, so it's got to be handled by the two houses.
Yeah. So what would you want to see after the
First of all, there has to be a budget, or monies have to be raised. Then there is an internal auditor, and there is an external auditor, in this case, the Auditor General. The Auditor General has pointed out a lot of malpractices in this process, which publicly has not worked, or there are many complaints about it in the public, and many people feel that it has not served them, which goes back to the history of the law. Unfortunately, in the Kenya Kwanza regime, law leaves from the cabinet or state house, come to the house, there is a debate of some sort, and eventually goes back for signature the way it came from the cabinet. The problem has been, having what you call majority. They should have their say, and having a way of voting, the way laws are voted for, having a way of making sure that law goes through, whatever the case. And I remember when the Housing law came and this SHA law came, there was such lobbying in Parliament that it must go the way it is. And therefore, that has been the problem. I don't think Parliament has performed as it should.
Right.
I think one of the weakest links here is Parliament. In fact, as far as many laws are concerned which have been passed, they have been faulted at the High Court and taken back, or nullified or found to be unconstitutional. And therefore, this needs to be relooked keenly. You see, after an Auditor General has made a report, they have already made questions to the managers of SHA and SHI and were unable to be answered. And therefore, if answers were to be provided to the Auditor General, the Auditor General's report would have been favorable. But unfortunately, there were no answers, or proper answers given to the Auditor General. We know how the Ministry of Health has...
She was assessing the contract itself.
Yes, and that's where every trouble begins. It begins with the contract. You have, you have to utilize laws in London. You see, this country has no law. You have had all the flaws. and how there's even direct procurement, how some of the procurement issues are not consistent with the law. They are not consistent with the Constitution. And therefore, these are things now we need to rectify if this system will ever work. Because first of all, we need a working system. We need, health is everything. And we have seen, from the news reports, patients suffering. And when one is unwell and they are sick and they're looking for help and they cannot get it, it's very frustrating. So although we have made contributions, families end up fundraising. And the only place where it serves right, the member of parliament who passed such a law, have you taken a bribe in parliament, is the one who uses the same bribe.
Sorry, allow you to finish.
Or whatever convincing or persuasion. Let me use a better word. Having been persuaded to pass a law, and then finally you end up fundraising for some people. I can assure you, you spend more money fundraising than a working system. If we had a working system, the members of parliament would have an easier time dealing with the people. So it is upon us.
When you say that members of parliament took bribes,
pass these laws, that's what happens in the house.
Bribes.
Just hold on.
You've said that members of parliament took
and the whips have admitted. The whips have not denied.
We want to know if really
your own whips.
Session
is no longer in parliament nowadays. The whip, the whip of the house has admitted having persuaded members to pass a law. Well, sometimes I really don't know. It depends with the whips. The opposition members or those who don't want to be part of it, you are not counted. So long as they have the right number to pass the bill.
You don't receive offers yourself?
Well, they know you won't accept or you will know it is happening.
So nobody has approached you to take a bribe?
At least in the Gachagua matter, there was such approach and it didn't work.
How much
and
was
it had conditions.
How much was it?
It had conditions. It was an offer of 4 million shillings. If you vote yes, and if you take it and vote no, then you will not get to your home the same day. It was with the threats. Really? But the position was clear.
Who was
there are engines. Money? There were engines from the state. Engines from the state.
Who are those?
People who come to the house to convince people we want to vote. In fact, they said for Gachagua removal, they wanted 100% vote of Senate. Because for some time, they were not sure of the numbers.
Those agents are also members of parliament?
Some of them are members of parliament, others come from the, they come from the hill.
Have you reported this matter to anyone?
Sorry?
Have you reported this matter to anyone?
What happened is this, even I'm talking about it now, what happens, so long as you see, if you take the money, you must vote yes. If you know you are going to vote no because the report will be there, then you can't take the money. And we are saying this bribery of the house must stop. That's where the problem is. We are running the country through bribes.
Okay. Can I say something on this?
That's where SHA and SHE has a problem.
Chief.
And we have to, Chief. And SHE, all of them. That's why there's a problem, Chief.
Okay, let's take a look.
And money laws of the country have a problem because of that.
You can't leave
Parliament is not working.
Before you go there.
Unless we are still here, I just want to take a look at the feedback that has come to us at Citizen TV Kenya. Sam Gituku, the hashtag to use is Citizen Daybreak on what Kenyans are saying this morning. Franco Rinde, you're saying that the latest audit reveals shocking under the table deals within Social Health Authority. Millions are being channeled elsewhere under questionable contracts while ordinary citizens struggle with poor health care. Who is the beneficiary of this mess? Kenyans deserve transparency. Engineer Lazaro, you're saying that new model of universal health care structure not bad. The problem comes only on implementation. Government is quick to implement it before conducting proper consultations with stakeholders and thorough basic education to Kenyans. Why would we have a system worth 104 billion shillings that paid for by poor Kenyans but not owned by the government? Is this another e-citizen? This government lists health equipment that are charged much more than the cost of the equipment. That is Crispina's Adams. Kalam, you're saying on the SHA technology system, even the best systems in the world doesn't cost a whooping 104 billion shillings. This is open theft of public funds. Godi Baraza, you're saying we can now conclude that the SHA is a legally crafted Ponzi scheme that benefits some in government. We should revert back to NHIF and avoid these mysterious runarounds. It is important to note here that the system we're talking about is not owned by SHA. It is a contract that was signed between the Ministry of Health and a consortium of 3 companies led by Safaricom Limited, Payroll Limited, and Convergence Solutions. And there are different details that I'll be giving you shortly. But first, before we do that, let's listen to what the Controller of Budget had to say about some of the things she's not able to see as an officer.
Then there was the question from Mheshimiwa Kuria there on the housing fund. Now, I need to bring out the fact here that there is a lot of money that does not pass through the COB. And the housing fund, the SHIF, like you have seen, the railway development fund, the petroleum levy, all these funds are operated outside the consolidated fund and therefore not part of what I approve.
All right, she was referring to some of the funds that she's not able to see. She doesn't need to process the budgets for those institutions on what has been happening. I just wanted to indicate here that Safaricom, Payroll Limited, and Convergence Solutions. So Payroll Limited is owned by SIH Africa Limited, 100%. The owners of SIH Africa Limited are Inder Dip Singh Verde, who is an Indian by nationality. Judy Mwende Gatabaki is a director there, a Kenyan. Rufus Marundu Maina is a Kenyan. And Aswanth Bindu Lambodaran is an Indian nationality. Now, also, a Payroll Limited, this is now so those are the directors, but the ownership is as follows. Aswanth controls 50% of the shares, Indian nationality. Then there's Nishant Mishra, who controls the remainder of 50%, so purely owned by those 2. The other one is Convergence Solutions, and the directorship and ownership, Convergence Holding Company is a Kenyan company, owned and controls 90% of the Convergence Network Solution, which is part of the consortium with Safaricom. Pitfield Auto Limited, Kenyan by nationality, 5% of the shares. Abdullahi Abdi Sheikh has 5% of the shares within Convergence Solutions. And then, of course, there's a further breakdown of all those holding companies, or rather those owners. For Convergence Holding Company that controls 90% of Convergence Network Solutions, which is a member of the consortium, they are the following shareholders stroke directors. Issa Sheikh Mohammed is a Kenyan, 500 shares. Abdullahi Abdi Sheikh, a Kenyan, 500 shares. Comtech Consortium Limited, 403 shares. Galva Investments Limited, a Kenyan, 209 shares. Of course, Safaricom, 35% of the company is controlled by the Kenyan government, and the other owners are Vodafone Group at 39.9%, and there are institutions that have bought shares there at 0.83%, and others, including individuals, is 24.23%. So there's a bit of control by the government and Vodafone Group. Those are the owners of those companies that are members of the consortium developing the 104 billion shilling contract to provide a technological system that is going to be used by different agencies, including SHA. So it is not the SHA that signed the contract, it is the Ministry of Health with the consortium. That clarification is important for proper context. But now you had issues that you're raising with what Senator Manzo is saying, but also where do we take this conversation from now?
You see, Sam, I want to repeat, Kenyans want to receive health services. They don't want to care who this Apero or Convergence or Safaricom is. What I want to say is that...
But should they care?
They should, of course. They should, because this is their money. This is their money. But before you go to those things, they just want a working system. So we want to tell the government this morning that spare us a PR. Spare us all these explanations. Just make the system work so they don't have to come to TV every day to tell us this will work. No. just make sure that the system is working. If you agree with the PRO and Safaricom that the health center dispensary in Ugenya will have this laboratory, will have a pharmacy, take them there. If you agreed with a PRO and whoever it is, that the first plot somewhere in Ugenya will have these services, you know, a theater and all these things, make sure those things are there. That's what you must do. Before we talk about all these things, can you ensure that the health service system is working? Because somewhere where I sit, and I want to declare here, Manzo, I'm serving my third term, and I've never received a single cent from anybody voting in Parliament. So help me God. I've never. If this health law is brought back today, I'll vote for them, because I believe in the health laws. I believe they're the best laws for the country. I believe so, with my heart totally. What we must work on is ensuring that what we pass in Parliament is implemented to the letter. We should not try to placate or protect anybody. If there's anybody who is complicit in causing loss of money, let EACC kick in. Let DCIC kick in. And let Parliament, because the Auditor General has spoken, let Parliament at the PSC do its job. Let's ensure that if there are questions about, because this is huge, this is something, not something small. And I want to talk to the ministry today. Be the minister, the PS, health. We are tired of PR. We are tired of very long paragraphs about how this thing is this and that. We just want services to the public, period.
All right, Mheshimiwa Susan, in closing.
Yes, I think moving forward, because the issue here relates to the Digital Health Act, which is domiciled within the State Department and not at SHA. That then, from my knowledge, is that there ought to be regulations to govern the whole of this process. And those regulations, which have to go through Parliament, will go through public participation and the public.
Sorry, regulations for what?
Yeah, to implement the Digital Health Act, and that is going to guide even this procurement system and this infrastructure that we are talking about. So I agree with Mheshimiwa here. Can we implement not just the law?
We bought something without regulations by the implementing agency?
Yes, the regulations have not been passed.
Is that a problem?
No, the regulations have not been passed. And
that's what I'm asking.
Yes.
The acts are in place, yes. But you went to the market, shopped for a system. The owner, which should be the Digital Health Authority, does not have the regulations
with the Digital
procurement.
Yes, currently it doesn't have the regulations. And what I guess
is that in order? Can we do that procurement without the supporting regulations?
This is where Parliament comes in. It was not enough to have the acts in place, but ensure that the regulations are in place and this program is properly supervised. Some, we are talking about dialysis patients who are being handled properly now with the advent of SHA.
That's all fine. I think you're talking about the procurement process.
The general success.
Yes.
But then it cannot be dogged by simple issues like lack of regulations, like lack of disclosure, lack of public communication, lack of education, like Honorable Manzo lacks a lot of education.
You don't think that's important?
There are no regulations, admit.
So all should be put in place. The regulations, proper civic education, proper communication. Like if you look at SHIF, for example, we have enrolled 20 million contributors. We have enrolled 20 million contributors.
You're saying it is okay to implement the universal health coverage without the prerequisite regulations. So it is okay to do that?
No, according to me, if times could be turned back, then by 1st of October 2024, we should have had the regulations and the laws in place.
We have the regulations. We have the...
Yes. He's saying the regulations for digital health.
For the digital.
They are never brought to the
For the digital health. That is a fact that is there. And that we cannot run away from that fact. And these are some of the things that Parliament and line ministries have to implement. Because, Sam, if we want to get out of this conversation so that this system works seamlessly, we must put all the regulations in place and operationalize the act properly, roll out civic education clearly. If Kenyans don't know that even at the primary healthcare facilities, they're supposed to be treated for free, then we're in problem.
So and that's what I'm asking you. So it is okay to do all that, and it's also okay to go ahead and spend 104 billion shillings of Kenyans' money.
104 billion shillings has not been spent because
no. You look at the commitments.
It has not been spent.
Sorry,
that is a fact.
Mheshimiwa Susion. Okay, so what has been spent?
104 billion has not been spent. Even that 2.5% that has been talked about was just but a mere proposal. And all that will fall in place. A contract is in place. Yes. And all that will fall in place once the regulations are in place.
Mheshimiwa,
so I think in all this ecosystem...
Sorry, Mheshimiwa, are you aware there's a contract between the consortium led by Safaricom and the Ministry of Health?
And it is not even specific about 2.5%. It's not there.
The Auditor General is responding on the contract that she has.
That is why this report of the Auditor General that has come out must be subjected to parliamentary process.
Have you seen the contract?
Those facts will come out.
Mheshimiwa Susan, have you seen the contract?
Show me the contract.
No, I'm asking you, have you seen it?
Show me the contract. I've seen it.
Sorry, just answer the question. Have you seen the contract?
I have not seen.
The Auditor General says she has
seen the report of the user. I've seen the report of the Auditor General. I've seen the response even of the Ministry.
You doubt the Auditor General?
I doubt the Auditor General.
Why?
Quite a number of facts will not fall in place. I am sure once Parliament oversights this process and the Ministry is given a chance, you are entertaining the report of the Auditor General. You are not entertaining the response from the Ministry.
Where is the response? Where is it?
Have you sought for it?
No. Surely. We can only deal with the facts.
Because we cannot give the country one side of information. And then magnify failure, where absolutely there's no failure.
Let's close this.
No, and that's a fact, Sammy, because the truth will fall in place.
It's a fact.
I was making my final conclusion.
Sorry, you're out of time. You know, you're using facts and truth in the same sentence. I don't know what that means.
Sam, for me, I think the most important thing, I'll just go what Honorable David has said, that this must work for Kenyans. And for me, it is sad when Manzo say members of parliament took money and you have confirmed. So all of you, even senators, you normally take money. Is that why you're doing all these babalus with national things? But having said that, Sam, this is a program that absolutely was agreed then at the African Union. That every country in Africa must go through universal health care program. And when Mauzo was giving the report recently, he said Tanzania is doing it. The question now we should go back as Kenyans is as we look at things, because the problem with Kenya, Sam, we look at it, what is in it for me, before we think even it's health, and it's for the people, and it's human. So that is where the biggest problem, that is why some will be fighting to go back to NHIF, what was in it for me then that has been locked by SHA. But now we go back, I go back to the same question. Your 104 billion, it means we leased this system. And so we shall be paying it for the next 10 years. We need to be told if that is it. So that we tell Kenyans, so you have not lost money, but the money now you are paying is part of paying for this system. We have to be very clear on that. After that, we need to say, for me, I have registered people on SHA, Sam.
Yeah.
I have 6 patients at Kenyatta, one who has been in ICU from December. If that young man didn't have it, would have been lost.
Okay.
So it is, yes, good, it can support Kenyans, but as we end, what is in it for me, Kenyans? We must get out of that madness.
All right.
And stop reminding us NHIF, but focus on this thing and deal with those who have made it wrong and make it work for Kenyans.
All right. Here we are. So the Auditor General has spoken. Honorable Session does not agree with what the Auditor General found. He says 104 billion shillings has not been spent. Indeed, it has not been spent, but it will be spent because the members' contributions will be going to finance that project. The claims from hospitals will be going to finance that, and the Auditor General is saying that the revenue projections are at 111 billion shillings. This is over to Parliament because they are the consumers of this particular report and they can take action that no one else in this country can. Thank you so much for making time for us. Mheshimiwa Beatrice Elachi, Mheshimiwa Wilson Sossion, Mheshimiwa David Ocheng, and Senator Dan Manzo for making time for us. That's our time. Up next is Matter Social with Safina Cheng Oma. Bye for now.